Wellness Wednesday, sponsored by Baptist Health.
We're all looking for ways to get credit for exercise that's really just our normal daily routines, right? So what if I told you that 7,000 daily steps could significantly lower your risk for various health conditions? And here to break it all down for us is Baptist Health cardiologist Dr. Scott Davis. Good morning.
Good morning. How are you?
I'm doing great. How are you?
Good. So, one of our mantras on this segment is get off the couch. The two things I tell patients is drink your water and get off the couch.
As we're sitting on a couch.
Exactly. And so, the trend has been, with the smartwatches, like you have one, whether it's an Apple Watch or a Fitbit or a Garmin, is to keep up with your steps. And we've done segments on this program to talk about, the role of like moderate or high intensity exercise. We did a piece several months ago looking at like 150 minutes a week of moderate exercise or 75 minutes of vigorous exercise, but that's really hard to track. And so, we've all kind of learned about and heard the whole 10,000 steps per day. Fun fact, that actually has no scientific basis for it. It came from a Japanese pedometer, the way you measure steps, and the brand name was 10,000 steps. And so it just kind of carried forward. So researchers now out of Sydney, Australia, have published a new finding in Lancet recently, looking at 31 different studies, a meta-analysis where you look at multiple studies of the number of steps people have done, and then comparing that with risk reduction of either all-cause mortality, cardiovascular disease, cancer, dementia. And so they did a breakdown, and they found that 7,000 steps per day is the sweet spot. And that's an easier target to hit for folks because that encompasses more than just going out dedicated, walking around the block or going to the mall or going to your fitness center. It involves just doing your routine tasks around the house, getting laundry, going and going to the grocery store. And so there's been a significant reduction in all-cause mortality, a 47% reduction, and then in cancer deaths, in onset of diabetes, and then they looked at other parameters like dementia, fall risk. And so the take-home message here is, it's more is better to a degree. I mean, they looked at 12,000 steps as kind of being their cap between 2,000 and 12,000. More is better, but if you can hit 7,000 steps per day, whether you measure it on your smartwatch or whatever, then you do get significant benefit.
So that's all you have to do is get 7,000 steps a day. Dr. Davis, just a wealth of knowledge. Thank you so much for joining us this morning. Of course, if you want to get in touch with Baptist, just go to their website or give them a call. That information is right there on your screen.